All right, so we always try, don't get up, don't come yet, Ritika. Okay, we always try at this symposium to have a patient related to the work that we're presenting. And often it's for many attendees who are not clinicians, it's a unique presentation in the sense that we get a perspective from the patient of really what is it like to have some of these, or challenged by some of these clinical disorders that we call disorders. I have the pleasure of introducing Ritika Rakshit, whom I have not met, but now I have. And I know nothing about her other than what I've searched on LinkedIn, and certainly it doesn't talk about her medical history, so she'll do that. All right, but I know that she is a patient, I believe, of Haley Merkley. Haley, yes, and that she's a project management professional. So we should have really talked to her before we started preparing this symposium, because we could have used her. I'll just quote what she says on her site. I cut through the noise and chaos to prioritize on the right work at the right time to avoid burnout. So, you know, we should have had her from the start. Okay, so Ritika, I know you're not going to talk about project management, or I don't think so, so you're welcome to come and speak to us. And I've set up your PDF, so you can just click through.
Okay, awesome.
Is that all right?
Yeah. Yeah, I've never spoke about my thalassemia before publicly, so it's my first time. Really excited to be here. My slides. So I'm gonna.
Don't worry, you're good. Whoops.
Okay, I'll just keep going. So I'm a thalassemia beta intermediate 32-year-old adult patient. I'm transfusion dependent. I'm Indian. I was raised in Thailand. My parents are both carriers. They don't have thalassemia. They're both academics, thank God. They both have PhDs, and my dad's a Canadian research chair, and because of all that, I received the best-in-class care throughout my life. Now would be a good time. Okay, great. Where was I? So, chapter 1. So I was diagnosed as a toddler. Of course, it was a very shocking experience for my parents who had to receive that news. We didn't have genetic testing at the time in India, and so as a teenager, I started doing monthly CBCs. We would drive across the city in Bangkok to review the hemoglobin results once a month with the best specialist there. I was taking folic acid, I was taking hydroxyurea, which frankly didn't do that much for me, but it was very manageable. Of course, I wasn't very athletic. We avoided red meat and spinach, but very healthy overall, and participated actively in school and extracurriculars and social life. So then, I'll go back. Then I moved to UBC in Vancouver in 2010. I studied biological sciences there because I was obviously very innately curious how hemoglobin was affecting every impact of my life. At that time, I didn't really do regular checkups or blood work. I didn't have a specialist or a family doctor. It was challenging to navigate Canadian healthcare. It was new and just living an active life. So the next chapter is when my transfusion journey begins. At age 24, we found out about EMH while I was doing my immigration process with my family. And so we started at VGH, 3 units every 4 weeks. And I was there for many, many years and developed really close connections to the care team there. It was a hard transition as an adult to get used to regular blood transfusions. I created self-care routines to make it a fun experience, treats and shopping and things. Iron overload started a few years after that. Navigating access through pharmacare was the challenge there. Iron chelation is very unaffordable for out-of-pocket for most of the population. Then I had Dr. Merkley and her team. We had a very serious conversation about compliance towards my medication because it was 3 times a day and I was 25. And so she did a really great job explaining the very scary long-term impacts. And since then, I've had a great team really monitoring this as a long-term marathon sprint to reduce ferritin levels. Some of the challenges I have is travel. You know, I have to be here every 4 weeks without fail. And so my life is really scheduled around that. I got a dog because I don't travel as much as I would like. And this is when I started doing annual testing of MRI, ears, bone. All of the annual testing began, more management, but always really grateful for best-in-class care. Yeah, those are my medications. Okay. And then last chapter is luspatercept. So that began 2 years ago. I was really hesitant to try it because I just wanted a consistent schedule. I wanted my health to feel manageable. It already felt very consuming in a part-time job. I didn't want a new project to manage. But of course, my dad encouraged me and my family encouraged me to try it. I was one of the first few patients to be on it. It was really life-changing. I went from having 3 units to 1, but it was every 3 weeks. So then I had 3 appointments in a row, which was hard to manage as well. Those are the 3 appointments. And then Dr. Merkley and her team really helped streamline my experience as a patient. We moved my appointments to St. Paul's instead of EGH. A pilot cross-match program was kicked off to do blood work. And so I was able to go do it on my lunch break working from home. And then we started dealing with symptoms like bone pain, something else that we're still monitoring, and just challenges of managing all the medication and treatment I'm on. So yeah, chapter 5, what's next? I'm now part of a board for patient advocacy to do things like this. Challenges maybe having a family, we'll deal with that. Yeah, and then of course gene therapy and hoping for a permanent cure in my lifetime is the goal here. Really inspired by this conference and really grateful to be here and to give a chance to talk about my story and my experience and just be really excited for what's to come. Thank you. Do we have time for questions? Questions? I'm the expert on my life, so.
Well, first, thank you so much. I know this is always a challenge. It's not easy to get up and tell your personal medical history to a bunch of strangers in particular, but it's greatly appreciated by everybody. It brings new insights. You look fantastic, by the way, for somebody who you've described as having a chronic disease, and I think it speaks to the medical care and the advances that we have, and then you, obviously, being able to face what is a chronic disease that sounds like it's had an impact on your day-to-day existence.
Yeah.
So
that was the most important, looking presentable for this audience.
You did better than me. Okay, well, great. And does anybody else have anything?
Yeah, I'm really open book. You can ask me
Well,
any personal medical history.
You can have her in private and ask her questions anytime, I'm sure. All right. Thank you. Was there a question? Oh, good.
We know that there's a lot of science behind your treatment, but I'm interested if you could comment on the changes that were made when you said changes to 2 appointments a week, moved from VGH to St. Paul's. Like, maybe just talk a little bit about how when healthcare providers adjust our approach to your treatment, what that impact can have.
So, like, are you asking about like providers and the influence they had? And
Yeah, well, like the change about your
Yeah.
pilot cross-match program
Yes.
and looking there to see where we're trying to reduce your number of appointments
Yeah.
and make the care work for you rather
Yeah.
than around hospital.
Yeah. Yeah, I was really grateful to have a whole team. I have now a pharmacist, I have Nina, I have a nurse, we have a project manager that does events. It was definitely really challenging. I was also part of the CST program that did the Cerner implementation, so I kind of had a little bit of an inside scoop on what changing hospitals meant. It was a very slow journey. I don't think, nothing moved fast, but this is a 30-year story, and so I think there was lots of time that we took to make those changes, and it was a hard emotional decision to make, but I've now moved my work to be near St. Paul's as well, so it's kind of some long-term thinking and planning.
Are you experiencing any side effects from your new medication?
Yeah. I mean, we want to stay hopeful and positive, right? The bone pain is definitely real. It's very unpredictable. I think with the chronic condition, what you want is stability and routine so that you can have a life. And so, bone pain is something new because I've been used to having low hemoglobin and so fatigue from that level, but now I'm at the highest level of my hemoglobin count. It's at the highest it's ever been, almost 100. But, it comes with new side effects, and so my team and I have talked about, the trade-offs between that and do I want to not take this medication and go back to 3 appointments, the 3 units of blood. So it's definitely a trade-off because I'd rather spend less time on the 8th floor of St. Paul's Hospital, so, yeah.
This might be an uncomfortable question
It's
to
okay.
answer, but I'm a hematologist who also looks after patients with rare hematological diseases, and I think one of the hardest things as a clinician for me is getting access to medications that I know are going to help my patients,
Yeah.
and access in terms of getting them in Canada,
Yeah.
and also access in terms of them being able to pay for them.
Yes.
So you made this comment that even in the, in your younger days,
Yes.
paying for actually, how do you manage all of these costs of medications that, of course, are not always covered or not covered completely?
I honestly have never had to pay for medication out of pocket. Stephanie has been really helpful in making sure my pharmacare applications are submitted on time. It's an annual process, but yeah, to date, apart from all the Ubers and food and shopping, I have not paid out of pocket for medical expenses, and very grateful for that because it is very expensive. And yeah, it wouldn't be the case if I was living somewhere else.
Thank you very